All right, welcome back. You know, spine and back pain, unbearable. It can keep you from doing your everyday activities, but you don't have to live in pain.
Trinity Health of New England offers some innovative treatments to get you back to your daily life as quickly as possible.
Yeah, Nicole and I had the chance to speak with the chief of neurosurgery at St. Francis Hospital, Dr. David Spiro. Take a look.
Thank you so much for being here, Doctor.
Thanks for having me. It's a pleasure.
Who's coming to see you exactly? People with all types of ailments, or specifically spine and things like that?
Let's talk about how common spine pain is.
Okay.
You know, it's one of the most common presenting symptoms to a primary care doctor. But not everyone needs spine surgery. So very commonly, people come to see me, and they will need conservative management. And that's the primary thing that we need to do with most people with spine pain is conservative management. So at the Spine Institute of Connecticut, we have a collaborative team that we work with. So we have orthopedic spine surgeons, neurosurgeons, and interventional pain management physicians, as well as physical therapists, who all collaborate to help people with their spine pain. And we also have a dedicated OR team, so including an amazing team of OR nurses and OR technicians who exclusively do spine. In addition, you know, we have been blessed from our leadership with some of the best spine technology available today. In our OR, we have intraoperative 3D imaging, intraoperative navigation, and the newest technology, what's called the Mako robot. Now, the Mako robot has been around since 2006, and it's been utilized in millions of orthopedic joint replacement surgeries, but now it has been adapted for spine. Essentially, what they've done, they've taken, it's called the end effector. The hand of the robot has been altered to adapt to spine surgery, and it now links with our intraoperative navigation system and allows us to do precision placement of screws during spinal fusion surgery.
It's remarkable.
What are some of the most common conditions that people would need to see someone like you?
So, as I said, not everyone with back pain needs surgery. So,
is that the last step?
It's the last resort for anyone with a spine issue. Now, the most common symptoms that we are operating on, when you have a severely pinched nerve in the neck or in the lower back. So that would give you what's called radiculopathy, which is pain shooting down the arm in a specific nerve distribution, shooting down the leg in a specific nerve distribution. That correlates to the patient's imaging.
Is that different than sciatica?
That is sciatica. Now, sciatica is kind of a general term for a pinched nerve, and sciatica can come from different levels of pinched nerves in the spine.
And we're talking about quicker recovery with some of these procedures, is that right?
Yes, so my specialty is minimally invasive spine surgery, and I do utilize the Mako robot. So minimally invasive spine surgery involves small incisions, usually sometimes using navigation to actually pre-plan a trajectory through the patient's back. And I operate through small tubes. The smallest diameter is about 18-millimeter tube, which is placed by dilating through the musculature of the back.
Isn't that incredible?
I know, it's wild.
So the tube is docked on the spine. All the work gets done under an operating microscope. And when I'm done with what I have to do, whether it be a decompression operation to release pressure on a nerve, or remove arthritis, or remove a herniated disc, I withdraw the tube, the muscles spring right back into place, and the patients are up and walking in the recovery room. Even with spinal fusion surgeries, most of my patients are going home the next day. And I encourage them to walk even that evening after the surgery.
That's amazing. It's amazing how far technology has come. And what about like lower infection rates?
There's lower infection rates, less pain medication, less scarring, less wound issues. It does allow me to operate on patients with a slightly higher weight. You know, there's usually a weight restriction for patients in terms of being able to have spine surgery due to the increased risks. And, you know, I have a referral pattern that has allowed me to operate on patients with slightly higher weight. I do have limitations with that, as long as the medical clearance has been performed by their primary care doctor, and they meet all of my criteria.
All right, well, to learn more, please visit Trinity Health of newnewengland.org/spine. You can also find more on Facebook and Instagram at St. Francis CT.
Well, before we head off to break, let's bring you inside